Tattoos are a type of ink, so a nursing mom can get one without fear. Since tattoo ink is too large a molecule to make it into breast milk, your baby has no way of being exposed to any chemicals. Beware of the risks you and your baby will encounter when getting a tattoo. When needles are used in the process, it can, with improper technique, cause a blood-borne infection like HIV, which can be passed on to your baby through breast milk, or hepatitis, which can theoretically transfer to your baby through breastfeeding if your nipples are cracked to spread. So, make sure you choose a reputable tattoo artist who uses sterilized equipment and wears gloves. You should also follow your doctor's aftercare instructions, such as cleaning the area that was inked effectively and using antibiotic gel. Be on the lookout for any signs of infection, like redness or pain. A skin infection wouldn't be a risk to your baby, but it may need antibiotics to heal. Reporting these symptoms to your doctor is important so they can act accordingly. If antibiotics are needed, be sure to let them know you're breastfeeding and ask for a medication that's safe for nursing moms. Some people think it's risky for a mom who has already gotten a tattoo to nurse her baby. That's false, and here's how to make sure you're safe. Get tested for HIV and hepatitis before and while you're pregnant. These tests are often done when you're pregnant. Tattoo removal, which is done with a laser, is one of the safest types of body treatment. Plus, it's especially convenient for a nursing mom. So, can you get a tattoo while pregnant? Yes. You certainly can. This is one of the more significant concerns that many pregnant women have. If you decide to get a tattoo while pregnant, make sure that your artist follows safe practices. This includes wearing gloves while they're working, using sterilized and single-use equipment, and keeping availability for the first 24 hours in case there are any complications or issues. It's often worth the extra peace of mind to get a tattoo through a licensed shop instead of an artist affiliated with one. With that said, tattoo artists usually have to follow cleanliness policies and professional guidelines when providing their tattoo services. Additionally, the shop should be licensed by the city, county, and/or state where it's located. Henna tattoos are a great alternative, especially because they're temporary. They're safe as long as the inks use natural and some shade of brown, orange, or red dyes. You should never get tattooed with black henna because it contains paraphenylenediamine, PPD, which is unsafe for anyone. Now, can you have a tattoo removed while breastfeeding? Lasers remove tattoos in multiple sessions by breaking down the ink into smaller particles. These particles are then swept away by your immune system. Your liver filters out these unneeded particles, preventing them from getting reabsorbed into your body. Nobody knows if the particles could enter your milk supply and be passed to the baby. If you decide to remove your tattoos, wait until you're no longer breastfeeding to make sure the risk is minimal. Given the uncertainty of the safety of tattoo removal and breastfeeding, it is unlikely that a doctor will agree to move forward with the procedure while you're breastfeeding. How long after getting a tattoo should you wait to nurse? Tattoo professionals are not likely to tattoo a woman who is pregnant or breastfeeding. If you're the mother and want more information on how to get a tattoo after your baby is 9 to 12 months old, it's recommended that you speak to your baby's pediatrician or nursery nurse. If you're a nursing mom, the La Leche League recommends you wait until your baby is 9 to 12 months old and not wholly dependent on breast milk before you get a new tattoo. But, does ink affect breast milk? You may want to be careful while breastfeeding if you got a tattoo recently because the ink molecules continue to circulate in your body. It's best to talk with your doctor about it before nursing. Tattoo ink can take months and even years to break down in the body, so there's just no way of knowing right now if you can safely nurse after getting a tattoo without speaking to a doctor. How about the baby? Can tattoos harm your breastfed baby? It's not likely that tattoos you had prior to breastfeeding will harm the baby. These won't transfer from your dermal layer down into your breast milk. However, can you donate breast milk if you have tattoos? If you think you might be able to donate breast milk, be sure to keep in mind that the Human Milk Banking Association of America specifies that your tattoos must have been drawn with a single-use sterile needle, and a milk bank will screen your milk for safety 8 days after a new tattoo was applied. Was this video helpful? Kindly like, share, and subscribe to our channel.